We had a couple of days here. We have been working on committee bills that have been worked on through the interim, and we've been able to move them what we call straight across, meaning not putting them on the third reading calendar, but actually passing them. So we've been, I think, had a real productive couple of days. So with that, I'm going to open it up for questions.
The Medicaid bills are on the agenda for this afternoon. You spoke yesterday about efforts that are underway with legislative leadership and the governor's office to kind of come up with an alternative. When are we going to start seeing what that looks like as these other bills start moving through the system?
Senator Rickers, I think we're going to talk about that in caucus today. Is that right?
Yes, yeah.
Again, Senator Hammert's in the Rules Committee, but he's probably one of the ones that's been working on that. So we may wait for him, but I can tell you, I was aware Senator Christensen, I think, has a substitute. Are you aware of his substitute? Perfect timing, we're talking Medicaid. So do you want to talk a little bit about, and Lisa, you can go ahead and rephrase the question for me.
I was just asking with the Medicaid bills that have already been introduced coming up in committee today, what the progress is on the effort by leadership in the governor's office to come up with an alternative, a consensus, I guess.
So we're working with, I think, Senator Christensen to try to get a substitute in place that balances the desires to, one, continue to manage our budget and have, a balanced budget, be able to do that with what we heard the voters ask for, which is more coverage and the willingness to increase tax to pay for it.
And I think yesterday the parameters the president put on that was starts April 1st, goes to 138%. Are there any other parameters that you're looking at?
Sure.
Well, we do want to start April 1st. We'll go as high as we can go with the money we have. I'll just say it. Am I going to get beat up if I say this? We're going to go for. We're going to rely on the Affordable Care Act coverage, probably for those between 100 and 138%. At least based on what we're working on with Senator Christensen. And so from 100 to 138%, they will have coverage. And if we have money, extra money, we can talk about that. But I don't know that we think we're gonna have enough money to go that high.
The problem with that alteration, though, is it requires a waiver from the federal government that the Trump administration was not willing to give last year's version of this under.
The implementation we're going to propose does not require a waiver that there's any concern about getting. It's not going to.
So between 100 and 138%, we've been made aware that the federal government will pay 100% of the cost for a platinum program. Not 90-10, not 70-30, but 100% of actually a commercial policy on the exchange. And so that currently exists under the Affordable Care Act. And so if we can actually cover up to 138%, but do it through the exchange on a lot better percentage than 90-10 or 70-30, which gives sustainability to the program. It's pretty hard to be at 100%. So we're looking at that option, and hopefully that's part of the negotiations we're having right now. So that's, I believe that may be part of Senator Christensen's bill.
But that was, again, what Spendloves bill did last year and got nowhere because it requires a waiver to go below that 138% that's in full Medicaid expansion.
So let me explain that. We can do that today at 70-30. And so that's the proposal is to actually expand using 70-30 while we're waiting for a waiver. So we can have that April 1 date, so we can cover people from 0 to 138 on April 1, but it will cost us more.
And so we're willing to. So one, we'll have the sales tax revenue, but we'll look at a general fund appropriation as well to cover any shortfall to allow for the coverage.
What was it exactly that you heard voters say that they want
full expansion to 138 and they want a specific tax increase, or just that they want a tax increase that maybe we could increase to provide them that full expansion?
They're willing to pay for a tax increase to provide Medicaid to more people. We'll take it as far as we can with the tax increase that they approved.
That they approved, so it's that specific amount that was in the initiative, not that they just said, we want a tax increase.
And it, most people I've talked to, if we look at the numbers without going in, and we talked yesterday, and putting back in a hospital assessment, I think that's in Senator Christensen's substitute bill. And without eliminating the automatic COLA or inflationary increases, the initiative is not sustainable because we just run out of money. And so I think we heard from a lot of people yesterday that we need to do something. But it becomes even more sustainable if we allow the federal government to do what they've agreed to do and pay 100% of the coverage from 100 to 138, and people get a platinum commercial plan. And a commercial plan, I think, benefits most people. I think those that are insured, we think it's better coverage, and I'd have to do a one-for-one analysis. It's better for the provider for sure, and it's better for the insurance company. It's better for the state because it's 100%. We think it's better for the participant because it's a broader. We think it's a broader based coverage. So
Is there any? Oh, go ahead.
So we think it's, and again, we're trying to refine it to make sure it's as sustainable as possible.
Is there any way going forward to make sure initiatives are sustainable? That's, I think, a bigger question.
Yeah, Senator Hamlis, that's a big deal.
Yeah, no, that is a big deal, and it's really important to us. And we are looking at legislation to make sure that it's clear that what people are voting for relative to a tax increase or not. Even in this Medicaid one, you know, if you compare the two ballot initiatives, right, that our schools, I don't want to say it's our schools now initiative, but the question about tax for school versus the Medicaid initiative, if you look at how it came out on the ballot, one said, do you want a tax increase to fund schools? That failed miserably. Medicaid started with, do you want to expand Medicaid? Then in the middle it talked about by having a tax increase, and that one passed. I do think the way they are presented and making sure they're transparent in the way they're presented is important, and making sure that there is, if you're gonna impose an increased cost here, if we're running legislation, we have to get it funded. And if it's not funded, even if it passes, it essentially fails. And I think it's important that that same burden that we have, that same rule we have to play by, also the ballot initiatives have to play by.
So you would, this legislation you're talking about would alter the way an initiative is written if it includes a tax increase?
Yeah, that's not in Senator Christensen's.
No, this
No,
totally.
but I mean, you're
separate.
talking about separate legislation on initiatives
Yeah.
that would spell out, you
Increased
have
transparency.
to
with
put the
the-
tax increase up front?
I don't know that necessarily, but
Okay.
make sure it's transparent
Okay.
if there is a tax increase, and make sure that it's paying for itself.
And to speak to this too, thank you, I've been listening, is that we're very much, the people's voice needs to be heard, and obviously, we didn't do what we need to do, or we wouldn't have had all this. I agree with the when it was mixed up about transportation and education, I get that, but I'm seeing bills coming from the House that I think is not going to be free voice for people, so I'm very cautious about that. Just because we don't think it was done the right way, that doesn't mean we manipulate it to do what we think it should do. And I think if there's guidelines or whatever, but I'm very cautious about going into the voice of the people. They did that with signatures, that takes a lot. And what I'm seeing from the House is more laborsome than to get something on the ballot. It's just mixed up, and so I'm really concerned about this. The other thing is about Medicare expansion, that's near and dear to us, and you saw how the votes came down. We're listening to all the options. We're going to speak in caucus today about the two bills that are coming into committee, And we're looking at this option and this option. We are listening to everything. Do we want to be partners? Yes, if it needs to be, but we won't be partners if it's not the will of the people. And I think that we need to, and I have personal experience with this. I have 2 nieces that were desperately ill and they passed away that fit into this criteria. And if they hadn't have had this, their quality of life till they passed away would have been terrible. So I've lived it in my family and how that it needs to be done. We're together, to listening to conversation, to options, and to make sure that we do the best. But we hold dear that people need to be healthy. Can't have a weak society, an unhealthy society. They can't work, they can't prosper. So health is number 1 with us.
So I think the common ground that we're finding here is April 1, the initiatives expanded Medicaid on 138% on April 1. We're trying to sustain that date, make sure it happens April 1 as the initiative indicated. And as we cover the 138, the question will be, there'll be discussion on how that's done, but we're getting to the 138. So there probably isn't total agreement on how we get there. But, and then the other thing I think that we're seeing common ground on is that there probably needs to be more money brought into the effort, which is the hospital assessment, and the COLAs probably need to be eliminated. And so that's common ground. There'll be a lot of things that maybe aren't, but we're working through a process, and I think we're finding some good common ground.
So just to be clear, is that Christensen, the bill, going to be the vehicle for this consensus proposal among the?
So that's pretty much his substitute today, I believe. Now, he probably ought to speak to his own bill. I don't want to do that for him,
But
but I believe he's
trying to
putting
clarify.
most of that in his bill.
So it
So
will,
come to the committee, and we'll get it good. We'll get it really good.
but I also understood from our conversation yesterday that leadership and the governor's office were working on some kind of consensus legislation. You said none of the existing bills did
Well,
what you wanted.
we-
but are you using Christensen's bill now to carry that? Is
Yes,
that
last
fair?
night we met with, and Christensen's probably will be the one that will do that.
Okay,
Yes.
thank you, sorry, I just wanted to be clear.
That clear, yes. Want to make, so we had a leadership meeting last night, and I think we're now looking for Christensen's bill to be that good.
So the House is on board with that?
We believe so. We haven't talked to them. The Senate's on board.
Oh, leadership meeting, you mean
Meeting
Senate
Senate
leadership?
leadership.
Okay, thank you.
President, when you talk about common ground, are any of the groups that sponsored Prop 3 involved in these talks, or is that just common ground among legislators?
We've had just lots of different people from different interests. I think we've had some conversations with, I don't want to speak for them, but we have had conversations. Yeah.
But it sounds like you feel confident, President, that you can come up with something that will satisfy what voters wanted? Is that the goal?
That's surely the goal. We hope we can, and I guess our number one priority is, and Senator Ibsen may talk about a couple of things, but is trying to make sure whatever we do is sustainable. We don't have the ability to print money, so we have to either take away from another program, or we have to limit the program we're working with. We have to find a way to make our budget work. And if the revenue numbers don't work, we have to make decisions. And those are sometimes hard decisions. Senator Ibsen, you want to?
Well, we talk a lot about the voice of the people. We live in a republic, not a democracy. And across the state, this wasn't a unanimous vote. My Senate district in Washington County, it didn't pass. And I think there are others like that. So when we talk about the voice of the people, we got to talk about the voice of all the people, not just small groups that have the majority.
But that's how we elect representatives, right? It's not the,
No, I don't
Every
think that's
person,
right. No, we don't.
you're elected by a majority of your voters, everyone you
Everywhere,
represent didn't vote for you.
But I represent those people at the state legislature, and the statewide doesn't elect me. I represent my voters, and my voters did not pass it unanimously.
So-
Did not pass in Washington County, and it didn't pass in my Senate district.
So are you going to oppose whatever everyone comes up with this
No,
session?
I'm not, but we hear the voice of the people, and it's not necessarily 100% that way.
Good discussion, further questions? Attend the committee meeting today, it will be a good one, okay?
You're gonna
And
talk
we'll,
about,
and we'll be talking about this in caucus also, so the caucus is aware of it, but,
we attend that.
You can come to ours is open, we're gonna have discussions.
we've yet to have a discussion with our caucus in this type of detail, so we'll have it.
Do you plan to come up with a position caucus today, or is this just kind of an overview to? like-
May not, we don't know, we'll find out.
Lot
We'll
playing
tell
by
you.
ear that goes on.
It's all right.
We'll tell you after.
Maybe.
Anything else? Medicaid today, all right, anything? If not, we're gonna head to caucus, so thank you for being here, appreciate you coming. Oh, anything online before we take off? I didn't hear that. Okay, all right, so.
Good.